We're sitting here today with my patient Jennifer, who is now 2 weeks after having artificial disc replacements in her neck. She put 3 artificial discs in her neck 2 weeks ago. And so we're going to see how she's doing today at her 2-week post-op visit. 2 weeks ago, you had 3 artificial discs placed in your neck.
Correct.
How are you feeling now?
I feel fantastic.
Yeah. And you're a personal trainer, right?
I am.
You can tell you're really in shape.
Thank you.
And you have a very small incision here where we put the 3 artificial discs in the front of the neck. And you were having a lot of pain beforehand.
I was. I had a massive car accident about 25 years ago, and so as I got older, I'm going to be 50. As I got older, I just saw progression of more and more onset of pain, migraine headaches, pinched nerves, and it just got to the point where it was unbearable.
Good.
And I have not had one headache since this.
Great. All right.
Yeah.
And you were active, I think, right after the surgery, about a week or so.
Within 7 days, I was out walking 2 miles, and then on day 8, I think I walked 2 miles in the morning and 2 miles at night, and I progressed up to 8 miles. And and so consistently I'm doing at least 4 miles a day.
Great.
Mm-hmm.
Are you going to the gym yet, or are you going to start soon?
I was waiting for you to give me the clearance today.
Okay, well, this is our 2-week post-op.
Awesome.
So now we're going to let you start to go to the gym, and you can start doing weights, and you can do up to 10 pounds. I'm going to let you do 10. So let's start with 5-pound weights, especially with the upper body, and then ramp up gradually up to 10 pounds.
Okay.
And then when you get to the 4-week mark, then I'll let you do full exercise activity. Because it takes about 4 weeks for these artificial discs to heal into the bone and be solid. And then full-on activity after that. Because I know you're a personal trainer and you're very physically active. And so I'm going to let you return to full functional activity. Okay?
Right. Yeah, I've been allowing my clients to do all the racking of the weights, so they'll be happy when I can start
you can help them
assisting them again. And then I'm a competitive outrigger, so long term, when do you think I can get back into my sport?
6 weeks, so 4 weeks from now.
Great.
4 weeks from now.
Great.
And then, because I want you to get a few weeks of exercising and feeling confident.
Yes.
And I know it will work well. And then at the 6-week mark, then you can go outrigging in the whole thing.
Great.
Whatever you want to do at that point.
Yes.
And remember, any nerve healing issues, like the numbness, tingly stuff, which I think is doing better, isn't it?
I haven't had any issues. I was actually off of my pain meds, I believe by day 6. I didn't even feel the need to take any of the muscle relaxers or any of the painkillers. And I think day 7, I took 2 Tylenol, and then that was it. And I've been eating really, really clean because I think nutrition is the biggest component, too, of kind of healing your body on the inside. And I think this has been...
That's great, because you're absolutely right. Eating really healthily, eating very clean helps speed the recovery, increases our bone healing, increases the muscles and soft tissue healing. And then the ligament and nerves will repair. Nerve repair, as we said, lasts and takes the longest, but you're already doing quite well with your nerve function.
Right, I haven't had any tingling or anything.
Great.
So.
Now I notice the voice is a little hoarse, not hoarse, but a little hard to project, right?
Correct.
Right, so sometimes when we do artificial discs in the neck, we have to move the windpipe to the side. And when we push it over, there's a little nerve to the voice box, gets stretched, and then you can have a little hoarse voice. The vocal cord doesn't quite work the same.
Okay.
It will come back 100%, I'm certain of that. And then your voice will be back to normal and be able to project normally. So right now you might feel like it's hard to really...
Occasionally, yeah, I feel like I talk pretty fast for my job, and so occasionally I'll be like, okay, slow down just so I can kind of catch up. And actually the only thing that I've even noticed, like no pain, no muscle spasm or anything, I was eating full solid foods within 3 days. The only thing was just the liquids. I have to just drink a little bit slower, but that's getting better.
Great. Yeah, that also is about 3 to 4 weeks total, and you're 2 weeks now. So a couple more weeks and that should all resolve itself, and the voice as well.
And I must say that everybody I talk to is just amazed.
Great.
Like, can't believe that I'm up and active and moving. So thank you.
You're welcome. Artificial disc replacements in the neck are just fantastic, and the recoveries are just unbelievable compared to the other types of spine surgeries that I do. But neck surgeries and artificial discs in the neck are so satisfying and for me to do.
Yeah.
So
Thank
great.
you.
I'm glad you're doing well.
Feel fantastic.
All right, so I'm going to see you in 4 more weeks, okay?
Okay, great. Thank you so
All right,
much.
thank you.